Hey, good morning, everyone. This is Cory Walker with Pinnacle Solutions, and I am so excited that you guys took time out to join us this morning to learn more about how to uh, reduce your taxes and expand your benefits offerings to your employees at no added cost. Today's presenter, a gentleman that I have a lot of respect for, that I'm very happy to be in business with. He hails from Muscle Shoals, Alabama. His name is Josh Kelly, and he is leading Citadel Benefits Group. And we are just happy to be in partnership together to bring this information to you and what we're doing to help so many entities uh, provide more to their employees and their families, and ultimately improve how their businesses operate with this program. So with that being said, I'm going to step out of the way of greatness and turn it over to my partner, Mr. Josh Kelly.
Man, I'm gonna have to have you just travel with me, Cory, introducing me everywhere. That was fantastic. Thanks so much. Nice to meet everybody. I decided to share this with you. And with that being said, I'm going to dive in. This will take about 20 minutes. It should answer all the questions about what this is, how it works, how it can work for you. And then at the end of the presentation, we'll have plenty of time to answer any questions. Or if you're not comfortable talking in front of everybody, just reach out to Cory, and he and I will jump on the phone with you and kind of deep dive into some more things. But with that being said, let me share my screen here, and we'll get going. All right. So what we're going to talk about today on in this meeting is called a SMRP. And you probably never heard of this before, but what that stands for is Self-Insured Medical Reimbursement Program. So where this program came about was back in 2014 when the Affordable Care Act officially went into place. As we all know, it changed a lot of things. Mostly I remember it because maybe health insurance very expensive, but it did help a lot of people get coverage that couldn't get it. There's never anything that's perfect in every situation. But one of the goals of the politicians that put that in place was they were trying to get our population healthier, which makes sense because that's less taxing on the system down the road. And in order to accomplish that, they put some preventative care and wellness pieces in place. And then along with all of that came some new tax codes. So we just took those new tax codes, put them together with some that's been around for a long time, and we created this program. So the key benefits for you as the employer is one, there's no investment on your end. Matter of fact, it gives you an immediate financial impact to your bottom line. We're going to save you an average of about $550 per employee per year on payroll taxes. It's going to help with employee retention, loyalty, productivity. It's going to help reduce claims costs and any major medical plans you have in place. And everything's automated and simple to implement. And as far as your employees go, there's no change in their take-home pay. So if somebody brings home $500 a week now, they still bring home $500 on the program. It doesn't affect their tax return at the end of the year in a negative way. Each employee gets this robust health dashboard with access to telehealth doctors, nurses, life coaches. We have a health coaching program, addiction recovery, couples counseling. And then each employee is going to get an average of about $150 to spend each month on supplemental insurance like life insurance, accident plans, cancer policies, things like that. And what's great is all this happens again without changing that employee's take-home pay. And of course, you as the employer, you save money in the process. So here's an example. So let's say you have 25 employees. So if we're basing this on 25 employees, it's going to save you about $14,000 a year on payroll taxes. Now, this isn't a write it off at the end of the year type of savings. That same scenario there, next month you're on the program, you put about $1,200 back to the bottom line. Do the math for you. However many employees you have, multiply that by 550. That's how much you would save a year in payroll taxes. Again, it's employee funded. There's no new out-of-pocket expenses for you. There's no change in your employees' take-home pay. All the fees and premiums are paid for out of tax savings. And we're going to show
Join the meeting.
We're going to show you how the money part works here in a minute. But before we get into that, there's a couple things I want to show you first. One of those is there's some qualifications. Let me mute everybody there. All right, cool. So there's first thing I want to talk about is there's some qualifications. First thing on the qualifications, and the main thing really is they have to be a W-2 employee. Obviously, if we're dealing with tax savings, they have to have taxes coming out of their check in order for us to save any money there for them to participate. So if you have any 1099 people, they couldn't take advantage of this. And then the second part is they have to have some type of a health insurance plan. Now, as you know, there's no database that shows us who has what. So we handle the compliance on this for you. You don't have to offer health insurance for them to participate. They have to have something. So, obviously, if you offer health insurance, they're on your plan, they would definitely qualify, but they can be on a spouse's plan. They can be on mom and dad's, or even have an individual policy. And if there is by chance, none of your employees have health insurance, or you have some that need it, Cory has some things he can put in place to kind of check the box on that. We can pop in a really inexpensive minor medical plan for less than $60 a month that checks the box and gets some more coverage. But that's the only qualifications right there. And again, pretty simple and easy, so it should cover the majority of your employees there. The only caveat to this is if you have any employees that are getting some type of federal funding for their health insurance. So if you have anyone on Medicare, or if you have someone that's getting a supplement through the marketplace, they wouldn't be able to do this too, because that would cause a double dip situation, and because they're already getting a federal benefit for that side of it. But everybody else, good to go and can totally participate. The next thing I want to show you is the actual wellness plan itself. Now, there's a lot of stuff in this. And for sake of time, I want to be respectful of everyone on the Zoom today. I'm just going to hit the high points on it, but you'll still get a really good understanding of everything that's included. But what we'll do is Cory will send you out a follow-up after this Zoom with a recap of everything, and then we'll actually attach a booklet that'll break all of these benefits down in detail so you can kind of read through them at your convenience. So the first part here is our employee assistance program. A lot of times they're called EAPs. It's kind of like a concierge at a hotel. Their job's to kind of do, whatever it is you ask them to do within reason. But in this case, it's done over the telephone. So the employees can call in and get financial counseling, mental health counseling. They can talk to attorneys and get legal advice. We have a document library, and they'll review contracts. If you get diagnosed with something and you have questions, you want to talk to a doctor. I mean, pretty much anything you would WebMD or Google, you can now call in, talk to a real person, and get help with that. So all of that's included. There's also a website and an app that everything's housed in. I'm going to show you. And in it, too, there's a body fat index, a place to track things. And what's great about this program is not only do your employees get it, but their spouse gets access to it, and all their all their dependents can use it as well. And it doesn't cost anything extra. The most used portion of our program is our telehealth platform. I know you're probably familiar with telemedicine and how that works. A couple things, though, that are different about ours is we don't just give them access to physicians, but there's also teledentistry, and there's some more mental wellness capabilities. So anytime you have an employee that wants to talk to a doctor, they shoot a message through the app or call in, tell them what's going on. Doctor calls them right back. Same conversation they would have if they were face to face. They need medicine called in, medicine prescribed, labs ordered, referrals made. 90% of any of the things a physician would do if you were face to face with them, we can handle that over the telephone. They'll even, refill prescriptions. The only real limitations are, they can't physically touch you, obviously. They're not going to call anything control. Can't get any pain pills or anything like that. They're not doing any type of specialized medicine, but everything else is totally covered. It's available anytime, day or night, 24/7, 365. And the best part is it's totally free to the employee. There's no copay. It's unlimited. Of course, the spouse and dependents can use it as well. And it doesn't matter if they're on their health insurance or not. And speaking to the health insurance piece, another cool side effect of this is when you look at your major medical plans that you have in place now, which we don't touch anything that's currently in place, whatever benefits are there stays there. This doesn't affect that. That doesn't affect ours. But with your health insurance you have now, your rates are based off of utilization. So what that means is the more you use your health insurance, the more expensive it is, unfortunately. But what's great is when your employees are using our telehealth platform, that means they're not using their current major medical plan, which is going to drive that utilization down, which is going to eventually help you out with rates. At a minimum, it's going to kind of help rates stay flat, but in a lot of cases, we see rates actually go down over time because of usage of our program. So it saves money there, saves money on copays. But my favorite part is the absenteeism savings, because the employees don't have to take off work to go to the doctor. They can do it on their downtime on the weekend or driving home from work or lunch break, whatever. All that's included. The next thing is couple wise. It's a couples counseling service, just like traditional couples counseling, except it's done from home. It's private, it's confidential. You don't see anybody from church as you're walking out of a building somewhere downtown. It's a lot of great resources in there. It's not just if you're having problems. Like I've got it where it sends me an email a couple times a month reminding me to do something awesome for my wife, like bring some flowers home or hey, Josh, go and load the dishwasher. Just random things like that. Yeah, I'll take all the help I can get, but maybe they just want to level things up, more intimacy, romance, or you have some conflict you need to resolve, or some better communication. There's a lot of cool pieces in that to help out with your relationships. The next piece here is Freedom 365, and that's kind of like the couples counseling, but this is for people suffering with addiction problems, substance abuse issues, that type of stuff. The stats are they're not going to walk in their supervisor's office or your office and say, "Hey, I've got a problem with so and so here with this thing," because one, they don't want to get fired, but also, we want to get them help, if we could, but also, where do we go to do that? Can you afford to pay for it? Outpatient, inpatient treatment's expensive. Where do you go to do it? And but also, I don't want my employee impaired on the job, and we truly care about them. It's a weird situation because there's not a lot of resources out there. Well, this is a way the employee can get help without having to tell anybody. It's all confidentially done from home. It's private. Then, of course, the employee spouse and dependents can use this as well. There's videos, there's courses. It can connect them with meetings locally and different people to speak with. It's a great program. That's all included. And then the last thing I want to show you here is our health coaching. And so this is one of my favorite parts, is because it's customized. I've looked at several different diets in the past. You can tell the video, I'm not clearly on one right now, but I've always got a lot of excuses. Well, I've got bad knees, or I don't like to eat that, or the sun was too bright, or my tractor wouldn't start. I've got lots of excuses, right? We're good at that. And because those diets are one size fits all. Well, this is more than just a diet program. It's not just, hey, I want to lose weight, or maybe you want to quit smoking, or maybe you're diabetic and you want to get a better handle on that disease, or you want to run a 10K, at the end of October and want to get in shape for it. Whatever that is, you connect with our team. And it's made up of physicians, nurses, dietitians, personal trainers, life coaches. We have an amazing cadre of people there, and they build you out a custom plan based on mindset, nutrition, and exercise off of what you've told them and what you're trying to accomplish. And then the best part is you actually, one of our nurses gets assigned to you as a health coach, and help hold you accountable for that each month to make sure you hit your goals and help you along with that. There's many, many more things in this. I know I've gone really fast through all of this, but you can tell there's a lot of things in here. And one big thing to tell you before we move on is we understand HIPAA regulations. So everything's very secure. So none of the employees know what anybody's doing or not doing inside the system. And of course, you don't have access to that part either as the employer. So that's the wellness plan itself. And there's several things that I didn't have time to go over in this. It's very robust, many, many pieces to this. And obviously, you can see there's a lot of value in it. And I know no matter what industry we're in or how much we're paying people, we can all agree something we have in common is it's hard to find and keep employees right now. It's tough in the climate we're in. So having something like this in place, not only does it help you keep the people you have, but as you're growing, hiring, recruiting, this is just another tool in that toolbox to help get those new people on board as well. So now that that's in place for your company, all your employees are going to get that. And then that's what's going to trigger the money part. So the easiest way to explain how the money part works is I'm just going to show you a before and after check stub. So this is the before check stub, what it would look like before we put our program in place for you. In this example here, we've got Bob. He's a single guy, no kids. And just to make the math easy, we're going to say he only gets paid once a month. So right now, his gross pay is $5,000. Of course, that's before taxes. In this example, he's paying $300 towards his health insurance. We've got that going through a Section 125 cafeteria plan. So we're able to take him pre-tax that money. So we're able to take that $300 off the top. Then he pays taxes on what's left over. So in this case, that's $4,700. So based on that $4,700, he's going to pay all those taxes there. So he owes $1,253.32 in taxes. We're going to add back that $300 he's paying for the health insurance. So he's got a total of $1,553.32 coming off the $5,000. Leaves his net pay, his take-home pay, $3,446.68. So that's our baseline. That's what it would look like before we do it. And here's what it would look like after we put the program in place for you. So it's the same guy, same situation, same scenario. His gross pay is still $5,000. Of course, that's still before taxes. He's still paying $300 towards his health insurance in this example. We still got that going through the cafeteria plan where that money's getting pre-tax. Now we're going to say, okay, Bob, if you want to participate here in your company's program, there on the right-hand side, you're going to charge him $900 for that. But what's great is the IRS allows you to reimburse your employee for that expense. So there on the left-hand side, you're able to give him the $900 back in the same check. So this is your company's program. It's your wellness plan. It's your SMERP. Now we're administering it for you. We're handling all the back end, but it's your deal. You're the one that's doing the charging of the 900, but also crediting the 900. It's kind of like if I said, hey, Cory owes me $20, but I'm going to give him $20 for his birthday. He and I don't physically have to meet in Memphis. That's about halfway between us and swap hands to know a transactions happen because I'm doing both sides of it. You got a plus 20 and minus 20. It's the same thing right here. When we go to set this up in payroll, we put that 900 credit in there. We put that 900 charge in there. When you hit the button, it does that math. Those two numbers zero themselves out. But what's great is that 900 there on the right-hand side that we're charging, we're also able to take and run that through the cafeteria plan and pre-tax that money as well. So he was paying taxes on $4,700. Now we're able to take and lower those taxable wages by an extra 900. So now he only has to pay taxes on 3,800 of it. Well, obviously his taxes are less in that scenario. He was having to pay 1,253.32. Now he's only got to pay 948.53. That leaves a difference there, a tax savings that we created in this example of $304.79. So the way the program's structured and to keep things compliant, you can't take all that down to the net pay, unfortunately. It kind of goes over here into a bucket. Now that bucket of money, it has to be used towards insurance and health-related things. So right off the top, out of those tax savings we created there, that $304.79, there's an $80 admin fee that comes out, and that's the employee's portion of that wellness plan I showed you. And that leaves a difference there of what we call their allotment. So in this case, that's $224.79 left over. That's when Cory comes in, sits down with Bob. Hey, man, congratulations. Here's this program your company's putting into place for you. Here's all the things you're going to get. Hey, Bob, you've got $224.79 now to spend. So he asks them some questions, walks through all the policies that are available, helps them pick out what they want. In this example, Bob decided to spend that $224.79 on a cancer policy, an accident policy, disability, and some life insurance. So you add up all four of those policies. That's that $224.79 down to the penny. That's coming out. You got the $80 admin fee, the $300 for the health, and the $948 in taxes. Well, you add all of that up. He's back at $1,553.32 coming off the $5,000. His take-home pay stays the exact same as it was before, but now he's got that added wellness plan with the EAP and the telehealth and the counseling, health coaching, all those things I showed you. Plus, he's got 4 extra insurance policies he didn't have before. His take-home pay didn't change. He feels like he's getting it for free. Of course, we all know nothing's free ever, right? He's definitely paying for all of that stuff, but he's paying for it out of tax savings that we created. So each employee's allotment, the amount they get to spend each month on benefits, is going to be different from the person next to them because it's based on how much they pay in taxes. The more they pay in taxes, the more we can save them, the more they have to spend. Are they married, single? Do they have any kids? How much money do they make? All of that factors into it. Now, another thing that affects the number is if they're single, we do a $900 offset. But if they're married, we're able to do a $1,200 offset. But we're still averaging about $150 a month that each employee gets to spend on insurance products without their take-home pay changing, and they can buy a lot of things with that. So that's the employee side of it. Now, where you save money as the business owner, as you know, every dollar that we hold out of an employee's check for Social Security and Medicare, you have to match that dollar for dollar on those 941s. So if we're holding $290 here out of his check, you're doubling that, sending in, $580 to Uncle Sam. You're matching that $290. So if they're paying $290, you're paying $290. Well, when we lower the employee's taxable wages, that lowers how much they pay in taxes, which lowers how much you have to match. So based on that, we're going to save you an average of about $1,100 a year there per employee on that payroll tax match. Now, out of that $1,100 savings, you'll pay a $46 a month admin fee for your portion of that employee's program. The IRS says, hey, you got to have a little skin in the game too. Then that nets out saving you about $550 a year. So we're going to save you about $1,100. You're going to scoop $550 right off the top for profit, then pay out the rest at $46 a month so it cash flows. And there's never a situation that's ever cost your company money. It only saves you money. So that example I gave earlier, if you have 25 employees, I multiplied that by 550, works out to be about $14,000. But again, it's not a write it off. That very first month that person's on that program, that company is, they're going to put $1,200 back to the bottom line. And that's real money. If you were spending the previous month in taxes, that's now a pure profit. You can do whatever you need to with it. At its simplest form, we're saving you about $90 a month per employee. And then after you pay that $46 admin fee, you're scooping about $45 back to the bottom line each person. But that's pretty much it on how everything works. One other thing I want to talk to you about is that we have an ERISA attorney on our team. So we handle all the compliance documents, all the setup part. We make that super easy for you with the cafeteria plan and everything. Of course, we don't charge anything for that. We take care of all of that for you and make it easy. So that's how this works. So the next steps is we got a lot of different people on here, and if you're watching this after the Zoom, you're probably thinking, hey, there's a lot of big numbers and a lot of estimates we've given you. So we'd like to run you some hard numbers to make a decision off of, so that way you can see actually what it would be for your company. Doesn't lock you into anything, but it lets you make a decision off of real numbers there. We just need some basic payroll information. We have a simple census. You can pull a report out of your payroll software. It won't take 30 seconds to get it to us. We'll run it through our analyzer and generate you a proposal. The type of data we need is just basic, their name, how much money do they make, how do they withhold on taxes from a federal standpoint, how do they withhold on a state standpoint if you have state taxes where you are, anything that's coming out of their check pre-tax like retirement or insurance, anything that's coming out post-tax, other insurance policies, maybe uniforms, if they're paying child support, whatever. Basically anything that affects their take-home pay is the kind of data we need, which is all in your payroll software. But once we run that through our analyzer, we'll generate you a proposal. It's going to show you exactly how much you're going to save each month and each year. Then we'll list out all your employees individually and show you exactly how much each person has to spend on benefits, of course, without changing their take-home pay. At that point, you say, hey, let's do it. The enrollment process is a couple different ways we can do it. Cory and team can come in and meet with your employees one-on-one, walk them through everything, or we can do a virtual or / auto enrollment. A lot of companies are choosing the auto enrollment process because it's simple and easy. It's where everybody kind of gets the same thing. The communication to the employees, the messaging is the same either way. It's just, hey, Miss Employee, congratulations. Here's this program your company's putting into place for you. Here's all the things you're going to get. We walk them through all the wellness benefits. We don't really talk to them about the company saving money because, as you know, they don't really care. We make it all about them and kind of build you up as the hero in the process. And I say, ma'am, now that you've got this program, you get to take advantage of some tax codes. What the tax codes allow us to do is take a chunk of the money that's coming out of your check that you're having to pay in taxes each week, and now you get to use part of it to buy insurance. It's not going to change your take-home pay. It's not going to make your tax return go down. It's going to kind of feel like you're getting this for free. Of course, then we have that same spiel with them. Nothing's free. You're going to see this on your check stub. It's going to look different, but that take-home pay won't change. And so then we say, hey, here's how much you've got to spend. Let's pick out what you want. So that's how the face-to-face goes. On the auto or virtual enroll, we do the same communication, but we pick out a predetermined package for them. And everybody will get the same thing. And then we just give them a 30 days to opt out and say, hey, I don't want it, because this is a voluntary program. The virtual route is less impact on the day, less disruption, but even on the face-to-face, it's 10 minutes a person. It's real simple. It's just whatever you want to do on that. It doesn't matter to us. All the products that we offer through this are guaranteed issue. So what that means is you'll never have a situation where somebody doesn't qualify for a certain type of product because of their health or medical history, which is really nice. Everything's portable. So if they were to leave you for any reason, or quit, retire, even get fired, they can keep these products. Of course, they'd have to start paying for them with real money then. They couldn't pay for it with tax savings, but the rates won't ever go up, and they can keep them from now on, which is a really nice benefit. We can cover just them and their spouse, them and their kids, or their whole family. It's just whatever they want. We can build that out. Once we get everybody enrolled, the payroll portion and setup of this is really simple and easy. We handle all of this in-house with you. We break everything down by pay period. So we get on the phone with whoever handles your payroll. We walk them through setting it up. It's just setting up some pre and post tax deductions in there, and it's not very complicated at all. But we hold your hand with it and show you. We give you a spreadsheet with the exact numbers to plug in, so it's just a simple data entry. Once all that's in the system, we like to take and do a mock payroll. So basically, grab some before and after checks just to make sure everything's in right and everything's set up correctly, and nobody gets mad at us when payroll runs and if their check's messed up, because there's occasionally we catch a mistake. We got some bad numbers or something, or somebody flipped a number, and I'd rather catch it before payday than on payday. But once it's in the system, it's in the system. There's nothing extra you have to do each month. There's no extra reporting at the end of the year. This doesn't affect anything that you're doing currently or going to do. It just keeps on going. You just let us know if somebody leaves, or if you hire somebody new in, we get them in the program. We also have a TPA available, a third-party administrator, where we can consolidate billing for you if that's something you choose. There are some limitations depending on the insurance carriers used, whether they'll let us, go through that or not. But every situation is different. Cory picks the right carrier for the right situation based on, geography and other factors in there. And then that's it. You guys start saving money the next month, and of course the employees get access to all those benefits. So that's simple as it. The one thing on here to kind of cover an objection that we get sometimes is hey, Cory, this sounds too good to be true, right? Anytime something sounds too good to be true, usually is, most cases. And my response to that is a lot of times the stuff they do in Washington, D.C. doesn't make a lot of sense to me here on Main Street, and that's not a left or right or whichever side of the aisle. There's a lot of things that if I was writing the check out of my account, I probably wouldn't do what they were doing. But, ultimately, with this program, the goal is to get our population healthier, right? And because just in general, we're getting worse and worse by the day. Our population is getting larger. We're getting less healthy. There's a lot of different things that are popping up, some man-made, some not. And, that's taxing on the system, because eventually everybody's going to be on Medicare and things like that. So the healthier we are, the better it is in every situation. And in order to get somebody to do something, you have to use a carrot, right? You have to incentivize them to do that. So that's what this is for. Now, with that being said, there's a lot of tax codes involved with this. Generally, I leave those out of the presentation because most of the people I would be talking to wouldn't know what the tax codes were anyways. The tax code, as of recording of this, is like 90,000 pages. It's the most confusing thing in modern history. But I would be happy to jump on a Zoom with your CPA or your CFO or even you. And if you want to talk tax code, I'm open door, or pull back the curtains, whatever you want to say. I'll show you all that stuff. It's just, we have combined the two most boring things in the history, which is taxes and insurance. And we try to keep this pretty light and easy to understand. And if I started talking tax code in the middle of that presentation, it's a little too much for sure. So we kind of leave that out of it, but I'm happy to show anybody anything that they want to see, and kind of walk through that. So that's it. Cory, if you want, we can open up for some questions, or we can shut it down and take and let them pick back up one-on-one with us. It's up to you.
Yeah, sure. Let's do both. Let's just take a couple of minutes, and if there are any questions, we'll take maybe 2 or 3 questions, and then if there are more, we can certainly schedule a time outside of this time. But I mean, excellent presentation. I get excited when I see it every time because I feel like I'm doing something great, like I'm giving back in a way, you know what I mean? And I'm not just out here just trying to hustle up or, whatever the case may be. I'm actually giving something that makes a difference in the lives of business owners, companies, their employees, and their families. So if there are any questions, now is the time to unmute yourself and ask. And if not, of course, we'll follow up with you. And I will do a drawing here in just a minute. So just to, thank you guys for your participation. But are there any questions?
I take questions, Cory. Let me, Daryl, I see you right there. Give me 1 second. I want to mention something. One other thing is, it's not that you said something that made me think about this, Cory. It's not that the employees don't want these products. It's just they can't afford them. Everybody's living check to check right now. It's tighter than it ever was. Margins are razor thin. It's tough out there. At the time of this recording, everybody's going back to school, and I've got three daughters, and I added it up. It cost $2,000 just to get my kids back in school with clothes and shoes and fees and all the different things. And it's tough on people out there. And the challenge with that is that's the ones that need these products the most, because these are the ones that are covering those out of pocket expenses that health insurance doesn't pay for. And it's tough, because that's the people that extra $30 a month makes a difference. That might keep them from buying lunch one day or something. So it's a really cool situation to get these products in their hands, and they don't have to make a buying decision off what they can afford. They get to pick out what they want. And then one other thing, real quick, we'll go to Daryl's question is, listen, the census process is super easy. We can send you the census, you can fill it out, but there's a report in your software. Pull that report. If you have problems not finding that, just let us know, and we can jump on a Zoom with you and walk you through where that's at. Don't let it get complicated. At any point in this process where you feel frustrated or something's getting complicated or aggravating, something went wrong, call us. It will fix it. But I just wanted to pop that in there. And looks like I answered Daryl's question into that. So we were on the same wavelength there, man. Any questions from anyone else? All right, Cory, I don't think anybody's got anything else. Well, let's see here. Claudette's got something here. She says, how many employees should a company have in order to utilize these products? So um, uh, 15 is what I tell everybody. Hey, we need a minimum of 15. We will go down to 10 in certain situations. Below 10, it's just a lot of challenges, and it ends up being uh, not as much juice left after the squeeze for the employer there. So we look at 15 or larger, and there's no maximum size in the companies, but we can go down to 10 in certain situations if it makes sense for that group. But so as far as number, that's what we're looking at, 10 or above, but really best if it's 15 and up. Great question. Anything else, anybody? All right, well, Cory, I'm going to stop the recording, and you can take over and do your